Okay, this is part 4 of a lecture series I'm making from mouth to mitochondria. We've gone through the mouth, the gut, the liver, and the spleen. Now we're going to do the blood. This one's going to be longer. I might break it into a couple parts, and I'm going to explain you how blood flow works. This is a really important thing to learn. Doctors don't know this. And the reality is medical school is fake. Just like public schools are a fake education, medical school is fake medical training. And if you think that I'm, being obnoxious, arrogant, or joking, I'm not. I can assure you, I know better than you. This is the truth. You can take it or leave it, but here you'll at least have a chance to hear it. So if you have a doctor friend, you should tell them to watch this video. They'll learn the truth about blood flow. It's not taught in med school. And I've got friends that are AOA, first in their class, and they don't know this stuff, okay? I was all that stuff back in the old days. All right, so you're going to learn the truth about blood flow. Here it comes. This is valuable medical knowledge. It can really save people. I'm going in anatomic order, so it follows kind of like a med school curriculum, but I'm teaching the truth about stuff. So the first thing I would say is, if you eat a high-fat diet and low in fiber, it's like shooting fireworks at your brain. Pop, pop, pop. You're doing little tiny amounts of brain damage every day, which you won't even notice for 10, 15 years, but after that, you'll start having a more accelerated decline. And 40 years of doing this, and you're going to be a typical stupid pro, functional illiterate, really not capable of much. All right, so I'm going to show you what causes it and how to avoid it. Most of the big shots in the medical world, all they do is sell drugs, or they'll talk about mechanisms, but they don't know how to help anybody. Lorraine Day did something funny. She cataloged all these Nobel Prize winners in medicine, and it was like only 2 out of tons of them did anything that actually helps a person. All right, so here might be a better metaphor of it. The gut is just shooting damaging material at the brain when you eat a bad diet. That's what happens, all right? This is a summary. This could be like the summary slide of what I'm talking today. When you eat a bad diet, you're shooting toxins at your brain. Okay, I'll explain how that all works here. Okay, now here's the typical book that people think is, like a serious medical book. The Harvard textbook of pathophysiology of heart disease, a collaborative project of medical students and faculty. Oh, isn't this impressive? Okay. By the way, I did a fellowship with the emphasis on vascular disease at Harvard many years ago, back in the 1990s, and I can tell you, this is basically just lying to people and making sure they never get better. Textbooks will tell you that 90 to 95% of hypertension is essential, of unknown cause, idiopathic, meaning the doctor's an idiot and the patients are pathetic. These textbooks are stupid. They do not deserve respect, okay? For all the chronic diseases like obesity, hypertension, diabetes, coronary artery disease, atherosclerosis, they'll say something along the lines of, well, it's associated with aging. We know that. Sometimes it's genetic. It seems partly due to socioeconomic disparity, those damn racist white people that everybody wants to take over their countries and loves living in them. If they're so racist, why do they keep coming to them? Okay? But we just don't know. So take our pill and slow it down. The textbooks are so stupid, it's laughable. It's comic. And it's not just cardiology. It's all of internal medicine textbooks and their subspecialties. The neurology textbooks are stupid. The psychiatry textbooks are stupid. The endocrine textbooks are stupid. The infectious disease textbooks are stupid. You think I'm kidding. The more you learn, the more you'll realize that's an understatement. Okay, and then what's the typical thing ignoramuses say to people? They say, well, I've heard the Mediterranean diet is the best diet. The Mediterranean diet is totally stupid. The only thing it forbids is processed food. It allows alcohol, olive oil, canola oil, nuts, seeds, meat, chicken, fish. I call it the Antichrist diet because it promises salvation, but it doesn't deliver. It's stupid, okay? It's one more thing that turns the patient into a chump, into a cow that the medical system milks every day because they take all these pills. Okay, so what is blood pressure? It's your heart pumping blood. Why do you have blood pressure? To pump blood to the top of your brain against gravity. Okay, normal blood's like water. When you eat a high-fat diet, it sticks the red blood cells together, so you're pumping a milkshake. You need to pump a higher pressure to get the blood to the top of your brain. Sodium inhibits endothelial nitric oxide synthase, so you can't make as much nitric oxide vasodilator, so your arteries clamp down, they narrow. That's called vasoconstriction. So now you're pumping thick blood through a constricted system. Pressure has to go up. The number on the top is the systolic, means to contract, diastolic to relax in Greek. So the high number is systolic, low number diastolic. A normal blood pressure is like 110/70, okay? Severe hypertension, 200/100, for example, okay? All right, here's a little more precise numbers. And what they keep on doing is trying to walk the numbers down so they can treat more patients. The drug companies just want more money. Dr. McDougall used to not treat unless systolic was over 160. Sometimes he'd say over 150. If the pressure gets too high, theoretically, you could damage the arteries. You could even have an intracranial bleed, which is super rare, okay? Okay, now, and when a baby's born, they're around 90/60, by the way. And as long as you feel good, the lower blood pressure tends to be better. So here's something called the Windkessel effect. Your ascending thoracic aorta. Basically, it has a lot of elastic fibers, and they provide diastolic flow. When the left ventricle relaxes during diastole, the elastic fibers have elastic recoil. It recoils inward, and then that pushes up blood through the coronary arteries. Okay, when you have chronic hypertension due to the high-fat, high-sodium diets, over time you keep overstretching this ascending thoracic aorta, which is like your second heart, and eventually you lose the elastic fibers. You progressively lose them, and you can't replace them after maturity, let's say after you're in your 20s. So once you lose them, like an old sock that won't stay up anymore, the person gets worse and worse hypertension, and they get more and more systolic hypertension because you can't generate adequate diastolic flow, so you compensate by increasing systolic pressure to a higher number. But remember, you only perfuse the left ventricular muscle during diastole. So what this means is you're setting up a system that's going to have a vicious cycle. You have to pump longer and harder to generate more systolic flow, but you perfuse the left ventricle primarily during diastole, which there's less of, so you're going to get less blood flow to that left ventricle, which is pumping harder than ever before and becoming thicker, LVH, left ventricular hypertrophy, and you're heading towards congestive heart failure eventually, 4 or 5 decades of that. Okay, and then the Windkessel effect. Windkessel is the thing you use to blow air on a fire on the Kindle to get the fire to flame to start. So you're losing the Windkessel effect. This is the Windkessel effect, meaning that the ascending thoracic aorta is the second heart. Okay, and again, I've had hundreds of medical students over the years. Not a single one ever knows any of this stuff. Never have I ever had a medical student tell me they know what a Zeta potential is or that they know what a Windkessel effect is. That's why when you go to your doctor, don't think they know these things, because they really don't. And again, the smartest of the smartest don't know it, yet alone the average doctor. Okay. All right, here's just showing you the epidemiology. Because people say, well, I heard contradictory information, I heard paleo, keto, whatever. Paleo, keto is just nonsense to trick the chumps. This is from a Dr. McDougall lecture talking about Papua New Guinea Highlanders. They eat about 93% of their calories from sweet potatoes, okay? So that means about 95% of their calories, not over 94% are from carbohydrate, okay? Their protein is what? You're going to take the last 5.5%. Their protein's maybe around, 3%, 4%, call it 4%. Okay, and look at them. They're strong, muscular, skinny guys, all right? They don't have any hypertension. They don't get any coronary artery disease, almost none, all right? Their average total cholesterol was 150, triglycerides 142. They had a good normal serum uric acid, no diabetes, no gout. That's it. In these countries where they eat this way, they have no hypertension, no gout. They don't have any diabetes type 2. They don't have any coronary artery disease, please. Sweet potato is only 1% of the calories from fat. Now here's a nice study. This is from Kenya in 1929, Lancet Journal, written by an English doctor, Dr. Donison, okay? So you can look this up. Blood pressure in the African native. It's bearing upon the etiology of hyperpaesia. That means hypertension and atherosclerosis. Okay, so 1,800 consecutive adult male black men in Kenya, 1929. They checked all the patients that were admitted to the hospital for their blood pressure. In the USA, about 80% of them will be hypertensive. Okay, guess how many were hypertensive in Kenya in 1929? 0, because they ate a plant-based diet. 0, none, nada, ninguno. Okay? Neat. All right, so anyways, there's another thing I want to tell you about this study. They also then took men who were average age of 60 years of age, men from Europe, white guys, and a bunch of black men from Kenya. Okay, in 1929, the average white guy's blood pressure was 140/90, mildly hypertensive. The average black, 60 years old, was 107/67. Okay, they had the same blood pressure basically as like a newborn, a teenager. Okay, they don't get hypertensive ever. So that just shows you what a joke it is. And people say, well, why are the blacks so hypertensive in the United States? Because they eat a terrible diet. Most black people in the United States eat lots of processed food, and they also eat lots of fried food. So that's high fat, high sodium diet, and very low in potassium. It's really the ratio of potassium and sodium. So that's why they have hypertension off the charts. It's not genetic, because when I was a resident, I always go, well, it's genetic, black people, they're salt sensitive, what are you going to do? Oh, BS, they're never hypertensive when they eat a plant-based diet. And here are the Tarahumara of Mexico, northern Mexico, Copper Canyon area, the Sierra Madre Mountain. Sierra means like a saw. Okay, so these guys, they can run 100 miles in 2 days. They have a holiday once a year where they do that. Look at how healthy all these guys are, running in sandals. Kind of funny. And what do they eat? Tons of corn and beans and local greens. Their diet was about 12% of calories from fat. They're exercising like crazy. They don't own cars. They do a lot of farming. They had a virtual absence of hypertension, obesity, and the usual age-related rise in cholesterol. The average plasma cholesterol was 125. Okay. And then the companion population is the Pima, and they were sort of taken out of Mexico, moved into Arizona after the Mexican-American War, 1848. And they're sick off the charts. They're train wrecks, because they eat the standard American diet, the SAD diet. The Tarahumara are still running miles upon miles. A lot of people going out and visit them. Ruth Heidrich, the great triathlete marathoner lady who cured herself of metastatic breast cancer with the help of Dr. McDougall and a vegan diet. She went out and visited him. And there was also a guy named Christopher McDougall, not related to Dr. John McDougall, who wrote a book about him called Born to Run. Okay, then there's the Yanomami in Brazil, near Venezuela, the Amazon jungle. And these are sort of like these crazy Yanomami guys. They're the ones that are always fighting with each other, and they raid the other Yanomami villages, and they try to, they kill each other, and then they steal the women. That's the noble savage for you. Okay. Anyways, they don't add any salt to their food. They eat primarily plant foods. Their average blood pressure in the adults was 95/61. And they measured a lot of them. They measured over 10,000 men. No hypertension. Average blood pressure 95/61. They checked their urinary sodium. They almost couldn't find any sodium in the urine. It was like trace, okay? The point I'm making is, the kidney's designed to excrete potassium. It's designed to conserve sodium, because for our ancestors thousands of years ago, they ate tons of potassium, about 20 to 1 times more potassium than sodium, at least 10 to 1. Okay, so the kidney's designed for that. That's what it's made to do. All right, a little bit about Asian atherosclerosis versus Western atherosclerosis. So the difference is the Asians ate a low-fat diet. The Japanese, for example, in the 1960s, are eating tons of calories, and same thing with the Chinese, the Koreans. Tons of calories from white rice, which has only got 1% of calories from fat. So they're all skinny. 1 billion out of 1 billion white rice eaters are skinny. But they were smoking like a chimney, and they were eating tons of sodium, like 12 to 14 grams. That's also thought to be one of the reasons why the Okinawans who ate less sodium were not as hypertensive and sick as the mainland Japanese Persians. So this is called Asian atherosclerosis because this isolated hypertension causes intracranial atherosclerosis. Okay, versus if you eat a high-fat diet and you also have hypertension, then you get especially coronary artery disease, you also get carotid disease, you also get it in the legs and basically everywhere else. But the isolated pattern of intracranial hypertension is characteristic of very, very high sodium, very low fat diets. That's so-called Asian atherosclerosis. Okay, now why are so many people so stupid in the United States? And I see lots of stupid people every day, and I look at their brains for dementia, memory loss, cognitive decline, all this stuff. And the most common thing I see by far is like this, where the brain normally should be uptight against the skull. Here's a normal looking brain, so to speak, and here's what I see all the time: shrunken brains, atrophic brains. This is called atrophy. And the typical dictation for this would be diffuse cerebral atrophy, okay? Diffuse cerebral atrophy, and it's not in any specific distribution, it's just all over the place, all right? Especially these frontal lobes, but it's all over the place. And this is And this is not so-called Alzheimer's. They'll try to pretend it's Alzheimer's. Alzheimer's theoretically has a characteristic appearance of parietal atrophy and medial temporal lobe atrophy. But that's not what I see. I see diffuse atrophy all the time. By far, this is the most common thing I see. And this will make sense in a moment. Okay, so what are we talking about when we talk about brain atrophy? So here's the internal carotid artery, comes up into the brain. You can think of it like your hand. Imagine this is the common carotid artery, your forearm. Your thumb is the internal carotid artery, it goes up to the brain. Okay, your fingers are like the external carotid artery branches go to the face. Okay, but this internal carotid comes straight up into the brain. It's the big pipe. All right, then it gives off these little branches into the basal ganglia, the lower part of the brain. And these are called lenticulostriates because that's the lentiform nucleus, and this is also called the corpus striatum. But the bottom line is these lenticulostriate arteries, these are the ones that get trashed with hypertension. Severe hypertension can shear off the base of these, cause them to occlude, cause atherosclerosis, lead to lacunar infarct. Lacunar means a little hole in the brain. Very, 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 very rare. You can get intracranial bleed. Okay, then the blood has to come up over the top and perfuse this deep part of the brain, deep central part of the brain. At the level of the ventricles, it's called corona radiata. Above the ventricles, it's called centrum semiovale. And both the corona radiata, centrum semiovale, deep white matter, meaning the myelinated fibers coming through there, you can just call that the deep white matter. Okay, and we'll often call this area the periventricular white matter. In the periphery of the brain, you see it's traced. There's a ribbon that's called the gray matter ribbon. Cortex means cortex like the bark of a tree. It's the outer ring of the tree, the bark, and that's where most of the gray matter is. The cell bodies are your brain cells, are your neurons, okay? All right, so the point I'm making, there's a skull and crossbones here because this is where most of these little strokes happen. A lot of times they're silent strokes, and they're from a lack of perfusion. As you get more and more atherosclerosis throughout these segments, you drop the perfusion pressure of the deep white matter, and there isn't very good collateral blood flow here, so you get little strokes in this area. I can see in some patients, I can see hundreds in one patient. Okay, and the more of these you get, the stupider you get. Okay, and every one of them has a lack of blood-brain barrier on its periphery, a damaged blood-brain barrier. Okay, you can also get them if you overtreat hypertension because you need adequate blood coming up to these convexity. Convexity just means it's convex outward, this upper part of the brain. And then these are the deep penetrating arteries. And so if you overtreat your hypertension, you won't perfuse these areas and you're predisposed to getting these little strokes. I'm going to show you an MRI, what they look like here, just a real soon upcoming slide. Okay, but now it's time to know about what Jack Dellatore did. Jack Dellatore was this PhD scientist out in Texas, and what he did was he tied off the carotid artery in mice. And he would tie off the internal carotid artery, put a ligature on it, and then middle-aged and older mice, 2 months later, they'd be demented. And then he'd do an autopsy on them. The first time he did it, he expected to see a stroke, but there was no stroke. There was just a diffusely atrophic brain. So he goes, okay, well, gee, that's interesting. And he did all kinds of experiments. Tied off both carotids, tied off the verts, tied off a middle cerebral artery in different combinations of them. And all was the same thing. The chronically underperfused area would be atrophic, okay? A stroke, an acute stroke, an acute ischemic stroke, like an embolic stroke, you have a sudden total loss of blood supply in a part of the brain, then it dies, okay? But when it's just a partial loss, because there's still going to be some collateral, the brain doesn't die all of a sudden, it gradually dies, and the cells have enough time to recycle themselves. That's called apoptosis, programmed cell death. And so you just get a shrinkage of the brain, atrophy, and there's no visible stroke on a brain MRI. Anyways, at first you're saying to yourself, well, so what? How many people have severe internal carotid artery stenosis or occlusion? Not that many. Right, okay, but let's ask ourselves the more relevant question. How many people have cerebral hypoperfusion? Tons of them. Lots of people have cerebral hypoperfusion because they have overtreated their hypertension, dropped the pressure too low. Remember, the drug companies keep driving the numbers lower so they can give more drugs, sell more drugs. Also, if you have chronic untreated hypertension, the high pressure damages the blood vessels, causes intracranial atherosclerosis, and that leads to cerebral hypoperfusion. So you're damned if you do or damned if you don't. So it's not an easy game to win. There's only one good way to win the game is to eat the right food. All right, but anyways, you see my point. You overtreat the hypertension, you're screwed. You don't treat it at all and it's really bad, you're screwed. If you have AFib, you're also going to hyperperfuse your brain if you're not getting enough blood up there, which you often don't with AFib. So AFib is a major cause of dementia. Okay, it's also a cause of stroke too. We won't go into that, but it's a major cause of dementia, even without a frank stroke. CHF, congestive heart failure, you underperfuse your brain. You're like a mouse. It's a diffuse global mouse equivalent. AFib, same thing, diffuse global mouse equivalent. Let's see, aortic stenosis, aortic regurgitation, aortic valve disease, pretty common. Underperfuse the brain. Post-CABG, coronary artery bypass graft, open heart surgery for coronary artery disease, heart disease. they run the patient hypotensive in the emergency room. I stayed with my father in the ICU for a couple days after he had his surgery, and he came out of it okay, but they ran his pressure real low, like 90/60. I asked the anesthesiologist, why are you doing this? And he says, oh, we don't want him to bleed out. There's an anastomosis. I'm like, well, I don't want him to stroke out. Luckily, my dad made it through, but he was much healthier than the average patient. Okay, so anyways, those are mouse equivalents, and lots of people have other things going on causing diffuse lack of oxygen delivered to the brain, like they have sleep apnea, for example, OSA, obstructive sleep apnea. Okay, and then, what's the most common reason old people fall? Probably because they're taking too much hypertensive meds. They drop their pressure, Okay, and the same thing, they're underperfusing their brain. They're pretty high risk to get deep white matter strokes. Again, you want a Goldilocks balance. So how do you find the Goldilocks balance? You do what God meant you to do. Genesis 1:29, eat your plant foods, okay? Goldilocks wanted it just right, not too much, not too little. Okay, here's typical stroke and hypertension called lacunar infarct. So hypertension damages these arteries here, lenticulostrides, and okay, let me show this. I'll show it on this side. I think they got a better picture of it over on this side. And the hypertension will cause narrowing of the artery, occlusion of the artery, and you'll infarct the deep nuclei of the brain. These are called lenticulostride arteries. Lacune means like a hole. All right, I see these every day, a bunch of these. Okay, here is a brain MRI with a stroke. So here is an acute infarct. Pop in the thalamus, left thalamus. Pop. DWI, hyperintense. Bright on MRI means hyperintense. Here's a T1 sequence, so it's hypointense on T1. I don't have an ADC map to show you diffusion restriction. The ADC map goes dark with an acute stroke. Okay, but here's a T2, and you can see this is done at a later time. You basically got a hole in the brain, cavitated brain. That brain tissue is gone. It's not coming back. That parrot is dead. Anterior left thalamus, okay? And that's a lacunar infarct, a little hole in the brain from hypertension stroke. Now, everybody talks about hypertensive bleed and say, oh my God, I hope the patient doesn't have intracranial bleed. I almost never see hypertension, large bleed, IPH, intraparenchymal hematoma. So when you talk about diseases, there's something called the horse categories, okay? So the classic saying in medicine is when you hear hoofbeats, think of a horse, common diseases. Well, you know what? The horse is atrophy. The horse is periventricular flare hyperintensity, those deep white matter strokes. I can see tons of that all day long, every day. There's no exceptions. You can't work one day in the Western world of medicine and not see tons of this, okay? Then the next thing that's next most common is amyloid angiopathy, microhemorrhages, little black dots. I see those every day. I'll see, one or two of those. All right, one or two patients that have cerebral amyloid angiopathy. I'll see most of the patients that have this stuff. Okay, then you'll talk about intraparenchymal hemorrhage. That's an okapi. Okapi kind of looks like a combination of a giraffe and a zebra. It is a real animal. You'll see that at the zoo, but it's quite rare. All right, and then Alzheimer's disease. And there's such a thing as familial genetic Alzheimer's, but sporadic Alzheimer's, I'm not even sure it's a real disease. Most of what you hear about hypertension is just BS nonsense, trying to get more money given to researchers, okay, but it's mostly BS, okay. Like I said, you can't diagnose it while they're alive. You can't really diagnose it effectively while they're dead. Autopsy is not that precise, and you have no treatment for it. So what would you call a disease where there's no diagnosis and there's no treatment? You would call that BS, okay. That's sporadic Alzheimer's for you. Okay, so here is the dreaded. This is like dying of a shark bite, okay? It's so rare. Intraparenchymal hematoma, and here's a bad one. It's ruptured into the frontal horn of the lateral ventricle on the right, okay? But that's really, 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 really rare, okay? Now here's what I see every day. Here is cerebral amyloid angiopathy. Well, actually, this is more like a hypertensive pattern. The central infarcts, that's characteristic of hypertensive microhemorrhages, like we call these hypertensive lacunar infarcts, okay? But the peripheral microhemorrhages, these little black dots, hypointensity on an SWI sequence, susceptibility weighted imaging, that's characteristic of cerebral amyloid angiopathy, okay? And then here's the deep white matter strokes. Anything that's white, bright, right here is a stroke. And you'll get more and more of them until they coalesce. But if you start counting these, look how many there are. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. You see, you can easily count to 50, even 100 in one patient. This is just one image. There's going to be a bunch of these images going up and down. Okay, so I told you that last thing, that was like a okapi. Cerebral amyloid angiopathy is like a zebra. Okay, hypertension-related infarcts are like a horse. Tons of them every day. You know, most Americans over 50 have hypertension. All right, just so you know, like what normal looks like. Here's normal. Normal size ventricles are small. This brain is full and normal. It's uptight against the skull, the calvarium. And here's a typical cognitive decline, demented old brain. The sulci are more and more prominent. That means there's more cerebral spinal fluid because the brain has atrophied. It's shrunken. And the cerebral ventricles are also much bigger. They've expanded into the destroyed brain tissue. And these are all a bunch of deep white matter strokes. Okay, every day I see tons of this. Flare is just the name of the sequence that means basically a CSF suppressed T2 sequence. T2 in the sense that the fluid is bright in the signal, but the CSF, cerebral spinal fluid, is suppressed. Okay, let's go to the next slide here. All right, and the point I wanted to make with this paper is just that wherever you have a deep white matter stroke, that means you have a loss of blood-brain barrier. Blood-brain barrier failure as a core mechanism in cerebral small vessel disease and dementia. Yeah, and if you got blood-brain barrier, that means anything toxic you eat in your food can contact part of your brain, touch your brain, okay? Meaning that your microglia are going to be activated, they're going to react to it, and they're going to potentially release toxic chemicals. The microglia are the macrophages of the brain, the immune system cells of the brain, the sentinel macrophages, the guard cells of the brain, okay? And if they sense, hey, there's a toxin coming in from the gut, like LPS, bacterial endotoxin, they might just very well release their toxic chemicals and cause collateral damage to the brain cells in the vicinity. That's what I meant by you're throwing fireworks up at your brain. It'll make more sense in a moment, but hypertensive damage to the brain causes leaky blood-brain barrier. Diabetic damage to the brain causes leaky blood-brain barrier. Okay, a lack of dietary fiber, meaning a lack of tight junctions in the gut, means you don't have enough butyrate available to get to the brain and fix it. That will also cause leaky blood-brain barrier, because the fiber, dietary fiber being converted to butyrate, that same butyrate that gives you tight junctions in the gut is used to make tight junctions in the brain endothelial cells of the blood-brain barrier. So you will have leaky blood-brain barrier. So you're going to be throwing fireworks at your brain. Freaking stupid. It's like once you know this, it's like, why would you want to do things that hurt yourself? All right, and this is kind of the point I was making earlier, that when you have diabetes or hypertension, they basically cause atherosclerosis in your small vessels, and, you know, diabetes, thickening of the capillary basement membrane. So here's a normal one. The yellow is a thin capillary basement membrane. The green cells are like the vascular smooth muscle or the pericytes in the brain. These are red blood cells going through the capillary. These are endothelial cells, spindle-shaped on the far back wall of the capillary. These little blue circles are the oxygen going from the red blood cell to the neuron. And then when you got diabetes and hypertension will cause thickening of the muscle layers, and diabetes, thickening of the capillary basement membrane. You'll also get some fibrosis in here with the hypertension chronically. And this means less blue circles are getting to the axon, so you increase the risk this axon will be hypoxic. And you superimpose on that sodium vasoconstriction, you superimpose on that fat, causing these red cells to stick together into a Rouleaux formation, stack of coins, blood sludge. You're going to be getting less and less oxygen into these brain cells, and they're potentially going to die because of that. Okay, so here's what I mean by the little vocabulary of blood vessels. So here's a normal artery, normal diameter artery. Here's the wall of the artery. When it's vasoconstricted, the muscles around it are constricted. The lumen, the part where the blood flows, is narrowed. Okay, things that cause vasoconstriction: smoking tobacco, fluoride toothpaste, excess dietary sodium, excess dietary uric acid, psychological stress. Sleep deprivation is a stress equivalent. Caffeine is a stress equivalent. Cold weather, decongestant, vasoconstrictor, sympathetic mimicking medications. Okay, and here's a dilated artery. You know, when you go out and walk in the sun, you feel good, your arteries dilate. When you're exercising, they dilate to the muscles. Potassium and magnesium help open them up, as well as plant nitrates as precursors to nitric oxide. Dietary fat, especially sad fat, inhibits inner mitochondrial membrane, causing diabetes. That's another big reason you don't want to eat high-fat diet. When you eat a high-fat diet, it makes your blood opaque. Here's a normal blood: the plasma, the white blood cells, buffy coat, the red blood cells down here, the hematocrit, which is about 45% of the blood. Okay, plasma is about 55%. So anyways, when your blood filled with fat, it becomes opaque. Not good. because you're eating a high-fat diet. These are the experiments done by Roy Swank showing we need a high-fat diet, especially saturated fat in his experience, but the PUFAs do it too, the omega-6s. That's been shown as well. They stick the red blood cells together, and that's called Rouleaux formation or blood sludge, stack of coins. Here's a good video at Dr. McDougall's if you haven't seen it before. It's Dr. McDougall Health and Medical Center YouTube channel. The name of the video is Blood Sludge, before and after eating a fatty meal. The fatty meal causes all the red cells to stick together. And Dr. Swank, the world's expert on multiple sclerosis, felt this was a major contributor to causation of multiple sclerosis, this blood sludge. So here's one of Swank's papers, and he showed that after eating, the chylomicrons cause blood sludge. The chylomicron is how the blood is packaged in the blood lipoproteins, and it caused major blood sludging. Okay, and he measured in what a hamster once got like 30% drop in oxygen delivery to the tissues. Okay, not good for the tissues getting an adequate oxygen, not good for your brain. Okay, now here's a paper by Gregory Sloop. He's a pioneer of atherothrombosis, atherosclerosis theory, and it's the effect of low-density lipoprotein, LDLs, on blood viscosity and the risk of atherosclerosis. So the LDL cholesterol sticks the red blood cells together, and the thicker your blood, the more likely it is to clot. Okay, so that's how LDL cholesterol causes atherosclerosis. By the way, what is atherosclerosis? Atherosclerosis is a blood clot. You need to know that. Okay, plasma triglycerides, they correlate with Rouleaux formation. You get more plasma triglycerides, fat, then you get more Rouleaux formation. You get decreased oxygen to the liver, to the tissues. So, okay, enhanced red blood cell aggregation reduces oxygen release from red blood cells in the microvessels. In conclusion, high triglyceride level prevents tissue oxygenation. Okay. Here was the work, initially Peter Quoll in the 1950s, a cardiologist in Pennsylvania, but later on other researchers showed this, like Ray Rosenman and Meyer Friedman, the ophthalmology doctors in the 1960s. And it was worse with the PUFAs, omega-6 fats, than it was with the SAT fat. With carbohydrate, the green line, you don't get any of this blood sludge. With the SAT fat, you get this black peak. And with the red PUFAs, you get a more prolonged peak. And the research assistants for these guys were getting pissed off because they'd start the patients at 8 in the morning and they'd still have thick blood into the evening. They wanted to go home, the workers. They would check their blood lipids every 30 minutes, and at peak lipemia in the blood, you'd have patients, Quoll's patients were cardiac angina patients. They would have episodes of coronary angina, chest pain. Okay. All right, so the higher the LDL cholesterol, the higher the blood viscosity, the thicker the blood, the more predisposed it is to clot. So here's the red blood cells, negative charge on the outer surface. That's called the Zeta potential. Something that overcomes the Zeta potential is called the bridging molecule. It sticks the red cells together. LDL cholesterol does that. Fibrinogen clotting protein does that. Uric acid does that. IgM antibodies do that. Here's the capillary wall. And these are the proteoglycans, and this is called your glycocalyx. Glyco means sugar, calyx means a coating. And it's got a sugar coming off these core proteins, and these are usually like a repeating disaccharide, meaning 2 units of sugar. And this is heparin sulfate, okay? And the sulfates are all very negatively charged, like a -2 charge on them. Here's a sulfate. And that will attract positive charges to it, like the hydrogens on water have a dipole, meaning a partial charge effect. The hydrogens have a partial positive charge, so they're attracted to the sulfates of the glycocalyx. And that makes it slippery, so the red cells going through the capillary can slip through better. The mnemonic, I made this up for the arterial wall, is 666, like the devil's number, but here's why it works. 600 nanometers is the height of this core protein. Okay, there's going to be adhesion molecules about this high, 60 nanometers, and then the plasma membrane itself, the phospholipid bilayer, is about 6 nanometers. Okay, so that helps you to conceptualize what's going on. Glycocalyx sticks up, imagine like trees on a hill. That's like what the glycocalyx is to the cell plasma membrane. Okay, so again, here's the red blood cells being stuck together by a bridging molecule. So normally a red blood cell is about 5 microns, a capillary is about 7 microns. So a red blood cell has to deform itself when it wants to go through a capillary. And if you have them all stuck together because of the fat sticking them together, the chylomicrons from fat, the triglycerides from fat, the LDL cholesterol from fat, then it's like trying to push a submarine sandwich through these capillaries. Pressure has to go up to make that happen. Okay, we're going to take a little break here, then we'll continue with some more of this video about blood and what happens when people eat high-fat diet and why it's a bad idea to eat a high-fat diet.